The outbreak of HMPV in Beijing, China comes like the cosmic force compelling leaders to once again shift politics away from governance. In spite of the deadly warning shots during the COVID-19 pandemic just a few years ago, do you suppose the leaders have taken healthcare delivery as a matter of urgent national priority? Asleep in another pandemic may be the price of a big gamble. No certainty anyone would live to tell the story. No doubt, the HMPV outbreak poses another reawakening call we all need to nip in the bud. And I'm glad to have Nigeria's Minister of State, Dr. Isiaq Salako. He joins us on Prime Time. Glad to have you join us on Prime Time.
Thank you, Indy. It's my pleasure to be here.
Fantastic. Let's start this way. Beijing is acknowledging a surge of the human metapneumovirus outbreak. Hospitals in China overrun with masked people. Should we here in Nigeria be agitated?
Well, I think that if we'll listen to WHO first, which is the Global Health Authority, the last advisory from WHO put the HMPV as a virus to monitor. And the communication between the WHO and the China health authorities, the China CDC, also suggests that whereas in some part of China, particularly the northern parts, they are seeing increased incidences of flu-like illnesses. They generally say that in this winter period, around our place, they tend to have an increase of flu-like illnesses. And they also said that an analysis of those flu-like illnesses shows that it was mostly caused by influenza virus, some of them by HMPV, and a few others, particularly in children, by a bacteria that is called Mycoplasma pneumoniae. And of course, if you also look at the analysis in Nigeria from the #1 Health Security Authority, which is the Center for Disease Control, the Nigerian Center for Disease Control, it also dovetailed that it is not something to start panicking about. Yes, the hypersensitivity sort of is good because from the experience of COVID that you alluded to, we must be more alert. And I think that what we are seeing is an increased alertness of the global community. But by and large, the China authorities says that they have not witnessed increase in admissions, and they have not witnessed increase in hospital utilization. And I believe that some of this information, the WHO will have their own network of independent verification. So that's the situation, as it were.
All right. Well, experts are saying it's been around for decades. I mean, that's what, and like you alluded to, is usually during winter period that this comes up. It is not new. It's not like it's not COVID-19. What more do people need to know about this health issue from what we have gathered? Every child, it affects almost every child by their 5th birthday. What more do we need to know?
Well, the fact that the virus has been around for a while, unlike COVID, it is not a novel virus. It is really a good news, because what it means is that recurrent infection will have resulted in some level of community immunity that would have been acquired. And so we expect that the outbreak, based on science, is not likely to be, even if it becomes a global outbreak, it's not likely to spread as rapidly as COVID because some level of community immunity will have been acquired over time because of recurrent infection of the virus. Like you said, it's been around. I was first isolated more than 2 decades ago, and in Nigeria, since 2011, there's been reported in research has been detected as part of the causes of upper respiratory and lower respiratory tract infection. So, but by and large, what people need to know is generally the preventive measures against influenza or flu-like diseases. You know that in Nigeria too, during this period, between the dry harmattan period, we also tend to experience an increase of that. So what the public need to know is first the precautions in terms of prevention. If you are having flu-like illness, it's usually better to isolate voluntarily, stay at home, don't go to work, don't go to the market, don't go to places where people are gathering because you can transmit the infection. And if the symptoms become serious, visit the hospital. And then, of course, the normal hand washing, ethics of coughing, of sneezing in public, hygiene should also be maintained. Good hydration, that's drinking enough water is also useful. The HMPV does not have a vaccine, and normally it is treated symptomatically. If somebody comes down with the disease, that means that if you have fever, we give something for
I was actually going to ask you, what are the observable symptoms and how should people guard against it? Yeah, observable symptoms.
The symptoms are the normal symptoms of common cold, sneezing, cough, fever, some level of headache. Generally, that's it, you know. Of course, in some people, especially in children and who are immunocompromised, it can lead to pneumonia, and then in which case you now have symptoms and signs of pneumonia, which can result in even pain in the chest and some shortness of breath. You know, difficulty in breathing can also happen, but that is not very common. Most people have this common cold thing that over time you just get out of it. And so that the symptoms, and the prevention is what I've mentioned, the hygiene, hand washing. When you cough, don't cough to the face of people, cover your mouth, whether with an handkerchief or with your elbow, and so on and so forth. Drink a lot of fluids, eat a lot of fruits to increase the level of your immunity. You know, those are the
I was just wondering, you know, because from what you've explained, it looks almost the same. I mean, the observable symptoms with cold. Isn't there a danger there of, you know, we're not saying it's going to be around or is around, of people not, you know, taking it quite seriously, and then it gets to, you know, a dangerous point. Isn't there a danger there?
Yes, I think it's always good to be alert. In this age of globalization, things happen very rapidly, and the movement of people is limitless, it's boundaryless, you know. So because of that, it's good for us to be on constant watch, constant alert, and I think that is what we're seeing now. And of course, because of the experience from COVID and how COVID appeared to have been hidden for a while before it was properly disclosed, there's some level of distrust, let me put it that way. So I think those are the factors that are accumulated to make us to be a little bit more anxious. But for us in Nigeria, all the things we need to do is being done to ensure that our surveillance activities is top-notch. In fact, what I can say is that Nigeria, if you compare to the time of COVID, the outbreak of COVID, Nigeria is better prepared to prevent, to detect, and to respond to infectious disease outbreaks. We're better prepared. Even the World Health Organization, the last joint external evaluation that was done last year, 2023, showed that there's been some degree of improvement in our level of preparedness. And we continue to work to increase that level of preparedness. We're better prepared in terms of the surveillance activities. We're better prepared in terms of our ability, laboratory facilities available to test and detect, you know. So I think that by and large for us in Nigeria, the health authorities will continue to do what needs to be done, but it's not something that the public need to
be agitated about.
Yes.
We'll probably talk along our discussion of better prepared in terms of personnel, in terms of training. Are we that prepared? Now you talked about globalization. Who is that is WHO? Sorry, is warning no travel or trade restrictions should be employed, by countries. We have the Chinese ambassador just came in, I think.
Foreign minister.
The foreign minister. He just came in the other day. So people coming from China, China people, they also do business here in China. Right. Of course, Nigerians go there, do business, come in. In this time of HMPV, what is the government doing to block, in case there's any entry from these sources?
Well, we have actually increased our surveillance activities at the ports of entries, the airports, the land borders, the sea borders. That's level of monitoring and surveillance at that level is higher. The health authorities are working with the airport authorities, the NCAA, the FAN, and all of those people who are at the airport. We are working with them to ensure that the level of monitoring and surveillance is higher, and then the level of suspicion is also higher because of the alerts that has been thrown out. So when we see somebody sneezing, we were more concerned to find out what is the causative organism of this sneezing, And then, of course, like you alluded, the WHO, which is the Global Health Authority, has advised. And of course, Nigeria can also not operate in isolation. We must be sensitive to our trade relations, our diplomatic relations. We must be sensitive to it. So as a result of that, no Chinese is not being denied entry into Nigeria. We're not denying anybody into the country, but it's just a matter of being more alert, increasing the level of surveillance and monitoring of people coming in from that part of the world.
All right. You've discussed about it. You've talked about it a little bit, but let's just stay on it a little bit further. In the event that Nigeria experiences a serious health emergency, how prepared are we? Talk about the provision of health in the budget. For example, it's 2.48, if I'm correct.
Yes.
And that does not even meet the Abuja declaration of 15%. And over the years, we have never been able to achieve that. So in terms of that, how prepared are we? Because, you can't talk about preparation and not talk about the finances, the financial muscle.
Absolutely. Well, like I said earlier on, compared to pre-COVID, we're better prepared. I'm not saying that we're 100% prepared, but clearly we're better prepared. If you go to the reference laboratory, our national reference laboratory here in Abuja, and also the National Institute of Medical Research, we have better facilities, laboratory facilities, to be able to test for viral illnesses, viral diseases like this MPV. So, and then in terms of the capacity of our personnel, we're better prepared. In terms of policy, environment, we're better prepared. Of course, we continue to face challenge of funding, but if you compare what is being done under this administration to what has been done in the past, you will see that we're making some level of progress in terms of funding for healthcare. In this year's budget, I think health is number 3 after security and education, in terms of the allocation of resources. So which means that health is a top priority for the government. And if you look at around the policy of President Bola Ahmed Tinubu in terms of avenues to improve local production of health products, in terms of giving some level of breathing space for pharmaceutical industries, so that they can bring the cost of inputs and products can come down. You will see that generally health is prioritized in the government of President Bola Ahmed Tinubu. This is probably the first time that the health sector is able to to engage professionals more quickly than other parts of the civil service will be able to engage staff. So because of the kind of attention and the kind of what I would call a kind of special treatment, as it were, that is being given to the recruitment of health personnel. So we are better prepared, but we are not. It's not yet Uhuru.
Not yet Uhuru. Let's discuss the FG's launch of 933 million fund grant cycle 7 in Nigeria for malaria, HIV, AIDS, and tuberculosis. How are states involved in this?
Well, most development, well, let me start that from the fact that one of the key approach of this government under President Bola Ahmed Tinubu is to ensure that our interface and our working with development partners is harmonized, so that even when you are going to work at the state level, we at the state and at the federal, we're speaking the same language. We have a common direction, and because of that, we have what we call the sector-wide approach that is being used to push the agenda of the president around health sector. So because of that, we have a better picture of what development partners are doing at the state level, because we jointly have some level of interaction at the federal level. We jointly agree the annual operational plans for each state is developed, and we have some level of input and some level of knowledge of what is in those AOPs. So because of that, I can say that generally some of these programs, the subnational levels are implementing it. As an example, if you look at issue of malaria that you mentioned, you see that at the state level, the malaria elimination programs at the state level, just as we have at the federal level, has also been domesticated at the state level, where they are able to also do activities around, particularly case management of malaria. In some states in Nigeria today, they still offer free treatment for malaria, but some activities like procurement of insecticide-treated nets has also been done. It's usually done centrally, but most of the time with the contribution of state, because when it becomes an issue of, for example, if it's through a facility, states are also involved, because sometimes the state may also be taking part of the facility that is used in the procurement of such commodities. So states are involved.
Would you really say that Nigeria, as it is today in health, that we have a clear-cut roadmap for epidemics? Would you say that? Would you be confident to say that we have a clear-cut roadmap in the event that we have epidemics, whatever kind of epidemics there are?
Well, I think largely we do. There's still some areas that we need to improve on, for example, we still need to strengthen some part of our laws, public health laws, to support some of those policy directions in terms of control of epidemics.
What's holding it before you continue?
First, you know that Nigeria is a federation, and health is on the concurrent list. And then some other areas that are not directly health but are contributing to health, for example, environment, for example, agric, are also on the concurrent list that states also have powers to legislate on. So when you are going to coordinate 36 different states, you must realize that it will take a while for us to be able to come into a consensus, so that whatever is done at the federal level, the state can quickly domesticate. Because if you do it at the federal level alone and it's not domesticated at the state level, you will find out that the level of impact will be very suboptimal. So we still have such few challenges here and there, but I think that we have a clear-cut direction in terms of our response, our ability to detect, our ability to prevent, and our ability to respond to epidemics.
All right. How has the government addressed, or how is government addressing this question of healthcare attrition occasioned by migrating professionals? I mean, most I don't know whether to say most, quite a number of our professionals are going abroad, and inadequate working conditions. How is the government addressing and making sure that this trend stopped or reduced or obliterated totally?
Well, the first is that for us, we see this migration from both angles of positive and negative. You know, you find out that when people migrate, they have better opportunity to interact with the global community.
Yes.
They're exposed to gather more skills, more experience, and quite a number of them are ready to come back to the country to support the health agenda of their country. Again, in the age of digitalization with telemedicine, people are also able to contribute even when they are not physically on ground. Of course, what we have done in terms of trying to is, you see that first, we have organized the health professionals in diaspora to a diaspora team, okay. And we engage with them regularly. In fact, next week, I think Wednesday or so, I'm going to be having a virtual meeting with our Nigerian health professionals in the United States of America, and that helps us to...
So even though they're out, they're still in?
They're still able to be useful. Again, what we have also done is to also expand our capacity to be able to train professionals. Of course, that will take a while before it's able to come on stream, but when we expand our capacity, if we have been producing 10 doctors before, if we are able to produce 20 doctors, so if 5 leaves or 10 leaves, we still have 10 retained
to fall back on.
So those are the, of course, we now have a clear-cut health professional migratory policy that is helping us to address this issue of attrition.
All right, let's talk a little bit. Let's talk about primary health care. What I have here is that WHO says 80 to 90%, that's quite a number, of healthcare needs can be met at the primary healthcare levels. But primary health systems in half of the Nigerian states are weak. What is government doing to really change this narrative?
The primary healthcare system is the bedrock of the health agenda of the government. And that is why the Basic Healthcare Provision Fund, which was provided in the National Health Act, enforced that 1% of consolidated revenue must be set aside to provide basic health care to vulnerable Nigerians especially. So that fund is being deployed essentially to the primary health care level. So you see that through the National Healthcare, Primary Healthcare Development Agency, selected primary healthcare facilities across the country receive quarterly grants from government for them to be able to procure drugs, pay hard work personnel, keep their compound clean, provide logistics, provide power, and so on and so forth. So that is being done at the primary healthcare level. Of course, we also have the insurance part of it, which is also being focused mainly at the primary healthcare level, targeting the vulnerable Nigerians so that they can receive care at almost free. You know, so that is a very, very strategic approach that we're adopting. Because if you look at our approach with immunization, it's also mostly done at the primary healthcare level. So you see that, generally speaking, the primary healthcare is receiving a lot more attention from the government. But of course, I must say that the health system is a chain, and you cannot afford to make any part of the chain weak. So as we'll focus on primary health care, we must also ensure that the secondary level to receive referrals from the primary health care is strengthened, and the tertiary level is also made top-notch, so that that chain is strong all
because,
through.
I mean, I was reading about, even when you pass the primary health care, the referral level also has a problem. When I get to talk about mortality, child mortality and maternal mortality here later on, we talked about vulnerables in the face of hardship and high cost of living that we're experiencing here in Nigeria. How are you tackling the challenge of urban-rural disparities in health care delivery, as well as access to health care facilities, particularly for the vulnerable group?
Well, a key pillar of the agenda of Mr. President for the healthcare sector is effective, accessible, qualitative healthcare. That is our number 2 pillar in the healthcare renewal investment initiative of the president. And what that means is that if you go around Nigeria now, you see that all the 36 states, including Abuja, now have social insurance schemes.
Okay.
And those social insurance schemes are basically targeted at vulnerable people. People with...
Are they aware of these schemes?
Yes, they are aware. I can tell you that in the last, since this admission started, we have increased the level of coverage of people in that scheme by more than 2.5 million. You may think that that is small, but if you consider that since 1999, when the insurance scheme was started, I think we were only able to achieve about 16 million people. So, which translates to maybe an average of about 500,000 per annum. So, in about a year, we have done about 2.5 additionally. So, people are aware and they are taking advantage of it. But of course, for us to grow our insurance optimally, it is not a responsibility of the government alone, whether at the federal or private state level. The private sector has a responsibility. For example, ARISE has a responsibility to insure you, to insure the staff here, and ensure that they pay premium for you, and then you also contribute some part of your salary to ensure that anytime you need healthcare, you don't have to dip your hand in the pocket to take that. So it is a collective responsibility of all. But government has gone out to target specifically the vulnerables to ensure that, okay, let us start from that level and gradually we can grow the insurance scheme of Nigeria.
Still on primary health care, Anambra State came tops in the second edition of the Primary Health Leadership Challenge. Interesting. Is this continuous, and what has Anambra done particularly that other states have not done? And is the federal government, the other states buying into that so we can, extrapolate?
Well, I must say that I'm not able to speak authoritatively on what Anambra did. This award is actually being coordinated by the Primary Healthcare Development Agency. And I believe they will continue because it's something to motivate and to ensure that people keep their eyes on the ball. But how it led to Anambra emerging, I do not know, because first I was not here as Minister of State at that time, and that particular mandate is being implemented by another agency of the ministry. But I believe that I'll get the executive director to brief me on it, and I can communicate back.
Yeah, because I know Bate was...
So you can inform Nigerians about it.
Okay. I was discussing with a doctor, and he said that what the pandemic, particularly the COVID, did for them, a commissioner in Ekiti State, he said they leveraged on the past pandemics, COVID, Ebola, etc., to improve the primary healthcare centers. Have we done that?
Yes. Generally, you see that first, even where we start from Nigerians, look at the level of concern that has come because of this report. If you compare the level of concern now and the level of concern that we had in 2020 when COVID broke, you see that everybody is more aware. And consciousness is a very important element of preparedness and response. Because if you are not conscious, you do not fish out what is abnormal, So the level of awareness and consciousness is higher, and that was helped basically by the COVID-19 pandemic. Of course, some of the trainings, some of the capacity building, some of the deployments of equipment that were done, I cannot say categorically now, but I know that when COVID broke, the level of molecular laboratory we had in Nigeria, maybe 5 or 6. But now we have in several other places, So that is a capacity that COVID has helped us to improve on. So basically, I think that as we talk about the bad part of COVID, we can also look at those good sides in terms of leveraging on that experience.
Let's discuss a little bit, if we have the time, on maternal mortality. I mentioned that earlier, and child mortality. not interestingly, it's not interestingly, it's actually a sad commentary. Records have it that Nigeria is responsible for 20% of the global maternal deaths. Between Nigeria and India is 34%. What is government doing to turn this trend around? Have we, what are we really doing if we can't have our mothers dying and our, if you like, unborn children or born children dying?
Yeah, there, one interesting fact is that 50% of the maternal mortality that occur in Nigeria happens in 22% of the local governments in the country. 50% of the maternal mortality that occurs in Nigeria is as a result of 22% of our local governments. It's happening in 22% of the local
governments. Okay.
So one of the key things that we have done, that is making use of data, is to now focus a lot of attention on those 22 local governments. And now we have this special intervention program that we call MAMI.
MAMI?
MAMI, yes.
M-A-M-I.
M-A-M-M-I.
Okay.
Which is a, let me not bother about the full meaning.
The full meaning.
It's basically targeted at ensuring that the issues around maternal mortality are addressed. And what are those issues? First, we talk about the delays. First, delay in taking decision at home, particularly in some parts of our country. Before the woman can go to the hospital, she has to take permission from the husband. So it causes delay. When decision is taken, delay in getting to the hospital, and when you now get to the hospital, delay in receiving care. So those three delays have been addressed. And now we now have an ambulance scheme. Apart from increasing the level of consciousness, the level of awareness, to ensure that we now involve husbands in antenatal care, so that they know that decisions has to be taken promptly when it needs to be taken. I've also put in place an evacuation program using ambulance scheme to be able to move people who need it from home to facilities where they are going to get care. And at the care level, we're putting together a monitoring mechanism to be able to ensure that any maternal death that happens, we do what we call oral autopsy. That means people go there to go and find out what happened. Why did this woman die? So that we understand very well what are the circumstances around it, and we'll be able to work to ensure that it doesn't happen again. So I can assure you that a lot of work is being done around maternal mortality. This is one of the key priorities of Mr. President, to ensure that we're able to bring this one significantly down.
All right, thank you so much, Minister of State for Health, Dr. Isiaq Salako, for being on our Prime Time.